Hello and welcome to the EduTalk series hosted by Biotone, Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise, not only for class discussion, but career success. Today's expert is Susan Salvo, a practicing massage therapist with over 40 years experience. She's an educator, an industry presenter, and author of 2 textbooks, Massage Therapy Pathology for Massage Professionals and Massage Therapy Principles and Practice. Plus, Susan's written numerous industry articles. She reviews case reports for the Massage Therapy Foundation and has participated in Massage Therapy Body of Knowledge Project and Council of State Governments Interstate Compact. And in addition, she has a blog entitled Susan Salvo's Massage Passport, a massage practitioner's guide to pathology, special populations, self-care, and improved professional practice. Additionally, Susan is a past presenter of EduTalks, and all EduTalks are recorded and posted to the EduTalk archive library on biotone.com. And you may want to tune in later today or tomorrow to a previous talk of Susan's pregnancy through the trimesters. So let's listen and learn tonight as Susan delves into pregnancy massage updates with practices and special focus on early pregnancy and unique circumstances. She'll review how massage therapy can reduce risk of preterm birth, along with additional ways to support your pregnant clients, including aromatherapy and hydrotherapy. And with that, again, thank you for joining us. Please be sure you are muted and video is off. Feel free to chat questions or comments, which Susan will answer at the end. And I know we have a lot to get to, Susan. I'm trying to rush through my intro, so I'm going to exit the screen, turn it over to you. I'll be back to help you with the chats, and it's all yours. Thank you so much for joining us tonight and sharing more information on pregnancy massage.
Well, thank you for that warm and welcoming intro, and thank you, Biotone, for having us and for being interested in not only educating massage therapists, but also for enlightening massage therapists on some of the new changes that are going on in the industry. So I'm going to be here to kind of teach you a little bit about some of the things I've learned as a presenter and as an author. So about every 4 years, I write a new textbook. And it's kind of my job to see if there's any new things that are down the pike. And I was kind of, when I say shocked, that's kind of a strong word, but I was really, really surprised to see some of the things had really made a shift in our profession. And so I created this presentation and was contacted by Biotone to say, hey, this would be a good topic for our audience. So I agreed, and I think I'm going to jump right in. Again, if you have any questions, you can put them in the chat box or wait till the end and ask me directly, either way. So I am going to go into my presentation right now and share my screen. And then I'm going to do from current slide. So this is pretty much a little bit about what you mentioned. I am an author. I do have a doctorate degree. I am board certified. That'd be another great conversation to look at what's going on in our industry, and the compact is definitely one of them, but board certification is something too that's relatively new. I am a perpetual student. Yes, I'm still enrolled in college, even though I do have a doctorate. I just got back from Spain taking a study abroad class, and I enrolled in business psychology this semester. Very much enjoying that. And then I'm going to take a class this summer on Japanese filmography. I know, but I love learning, and I do think it enhances me as an educator and also a massage therapist. It's important for me to mention to you that I'm an educator of not only CE classes like this, but also entry level. And I think that really allows me to have that broad perspective. What is entry level? What is considered advanced? And another thing that I do that really has informed my practice is I am an expert on legal cases. So if there has been an alleged injury by a massage therapist, I am often called to opine. That's the term that they use, to opine on a situation. I just took a legal case yesterday on misuse of a massage gun. So if we have a chance at the end, that might be an interesting topic to talk about with you. These are my textbook covers. Massage Therapy Principles and Practice is in its 7th edition. I'm about halfway through with 8th edition right now. The pathology book, I am about, I'm finished with it. This is gonna be the 6th edition. But that's gonna be coming out in about a year. But I can definitely talk to you about the topics that are in there. And the topics that I'm gonna be covering today are gonna be in the new textbooks coming out next year. So as a quick little reminder, what pregnancy massage is, it's the modifications of existing techniques. They're not new techniques. Modification of existing techniques and body positions to meet the needs of women and as they undergo changes during pregnancy. It does include the postpartum period. There is a movement in the profession to even change the name to call it perinatal massage, meaning the area around pregnancy, which would include the postpartum period. Some experts are calling the postpartum period the 4th trimester, which means a trimester is 3 months. So it would mean the 3-month period after pregnancy. And again, I do agree with that change in terminology. So now the first thing I'm going to mention some things that are just kind of interesting about the profession, things I'm noticing as a practitioner, because the pregnant client is so hyper aware about diseases and in ways that we've never been before. If your client wants you to mask up, just put on a mask and make the client comfortable. So that's the very first thing I want to mention right off the bat, is that our job is to make her as comfortable and to feel as safe and well taken care of as we can. Another thing that's fascinating to me, I just finished a class on disabilities for the American Massage Therapy Association. It was published as one of their CE courses, and I came across this. And it was so fascinating to me that if you have a condition that requires you to go to the bathroom, whether it's 1 or 2, you can actually apply for this just can't wait card. And if it's presented to a business that has a no public restroom policy, they must allow you access to their employee-only restroom. And if you look at this next one, that pregnancy is an eligible condition in some states. So, and what the rest of the slide mentions is some of the restrictions that do apply. But again, and this just shows you the different agencies that can issue these cards: Crohn's disease, ulcerative colitis, and IBS. And so I like to mention that because it's very, very important that we reduce barriers and improve access to clients who are pregnant. So the very first thing I want to mention is miscarriage or stillborn. Okay, so let's talk about those 2 conditions. A miscarriage is technically a non-induced embryonic or fetal death, or the passage of conception contents before 20 weeks gestation. So if it's after 20 weeks of gestation, we're now calling it stillbirth or stillborn, and not a miscarriage, or some people use the term spontaneous abortion. And then what I've added here is signs and symptoms of either, and there's going to be abdominal pelvic pain or cramping. That's going to be low in the abdominal region, vaginal bleeding or spotting, and a discharge of tissue. So the way that we're going to handle those situations is the body's trying to do something else during that time. So it's really better to postpone the massage during signs and symptoms that were listed on the previous slide of miscarriage or stillborn, and refer them to their healthcare provider. Now, maybe they're already talking to the healthcare provider, but it's still doing your due diligence to refer them to their healthcare provider. And this is going to be true for all trimesters, 1st, 2nd, and 3rd trimester. But massage is actually indicated after pregnancy loss. And let's look at some of those studies. So, you know, a lot of people have their favorite musician, their favorite movie star. I have some of my favorite researchers. So Sarah Fogarty, the woman who did this particular study, you'll see her also in other studies in this presentation, did a study on the use of massage to support emotional and physical health in pregnancy after a stillbirth. That this was a case study. And again, at some point, maybe we can come back and do a whole lecture just on research and the terms and what they mean. Very, very important if you want to have evidence-based practice. But case reports are typically the entrance, the threshold into a research topic. So, so she basically probably did the very first one on this topic. And so it was one person. So let's look at some of the study details. A 32-year-old pregnant woman received 7 massages over a 7-month period. The client experienced decreased anxiety, decreased sciatica pain, decreased stress, decreased shoulder tension and soreness, improved sleep, and improved well-being after each session. And the client self-reported that massage helped her cope with the previous pregnancy loss. Now, that's one study. Then this study came out. Again, you can see Sarah Fogarty again, and some of you may know some of these other researchers as well. Nikki Monk is very prevalent in the massage community, and her bio is actually in my 7th edition of my book. But this is a study. Now, I want you to look at this just for a second. You can even use a database to research clinical trials that are in progress. This is one of them. So 2024, do you see the word pilot feasibility study at the top? And it's Swedish massage as an adjunct approach to, now if you look at the acronym, then when you see the word HOPES, it will make sense. Help support individuals who are pregnant after experiencing a prior stillbirth. That's where the word HOPES come from. Now, this is a convergent parallel mixed methods study. And what they're doing, in fact, I contacted Sarah. She's an Australian. She's in Australia. I contacted her saying, is this study actually published yet? She says, no, we're finished, but we're crunching the data now. So it's not quite out. So definitely keep your eyes open for it when it comes out. I'll definitely post it when it does. But they recruited 75 individuals who were pregnant after a previous stillbirth. And they received 5 massages over a 4-month period at intervals of their choosing. And they're going to be 2 different kinds of things. One's called, we call it quantitative, one's qualitative. And that's what the last 2 bullets mention. And they're going to examine scores of anxiety, worry, and stress. But they're also going to do interviews to examine themes, thematic, qualitative, related to their experiences. So again, because we're talking about miscarriage and stillborn, we have to ask the question, re-answer the question, can massage cause fetal harm? So I'm gonna let you think about for just a second now, can it cause fetal harm? And the answer is absolutely not. There's been no cases, no evidence to suggest that it causes harm. And it's important to remember that pregnancy is actually a life stage. It's not a pathology. It's not an illness. It's just a life stage. Women are running marathons. Women are doing all kinds of, staying very physically active during pregnancy. So no, massage cannot harm the infant at all. And that's just kind of, this reinforces it. Massage cannot cause miscarriage. And denying services is unlawful, discriminatory, and unethical. So why is that? Number one, it violates the client's sense of autonomy. If you guys remember ethics and the principles of autonomy, autonomy is the client's ability to make decisions that affect their body, that affect their unborn. They have the right to make that decision once given all of the facts, not the myths, the facts. And there's been no cases that massage causes harm. But look at the second thing on this slide. It also violates their civil rights. And in 2021, the Congress expanded the civil rights law to many people in our community, like the trans population. And they added pregnancy status and nursing status to civil rights. So right now it is discriminatory and unlawful if you're going to have a restriction to pregnant clients in your practice. So the next we talk about is infertility. So what is infertility? It is the inability to conceive after 12 months of frequent unprotected intercourse, or the inability to remain pregnant, which means usually 2 or more miscarriages before you get the diagnosis of infertility. Now, this one's kind of interesting. So I want you to, first of all, put your eyes on the bottom of this slide. This is 4 studies that, and pretty recent, pretty clustered together. 4 studies that examined this massage table. And the term, I think, is adulation. You have to look them up for me, adulation. So they use a pregnancy massage that used heat and vibration before embryo transfers during in vitro IVF. And what they found is that massage, basically, even though it's a machine, massage improved pregnancy and birth rates, and they're different, pregnancy rates and birth rates. Now, this next slide, go down to the bottom again. I love the name of this study. This is Evans, a broader conclusion to a well-conceived study. I think that's funny, well-conceived, haha. Must it be massage before reproductive technology? And one of the things that they said is that the answer is yes. Yes, that the relaxation that the women received prior to embryo transfer improved uterine receptivity by decreasing uterine muscle tension. So I thought that was a very, very important thing about actually massage is important in the area leading up to pregnancy and then the first trimester. So the next thing we're going to take a look at is preeclampsia. And this is I have a couple things that surprised me when I dove into this topic. This is one of them. So first, we're going to define what preeclampsia is. Preeclampsia is persistent high blood pressure, protein in the urine. It was called proteinuria, and edema. It usually develops 20 weeks after gestation. If it's left untreated, it can lead to serious, even fatal complications for the mother and the unborn. The prevalence rates are about 5 to 8% of pregnancies in the United States. I did check about an hour ago, and it's about the same prevalence rates in Canada. And it's more common in first pregnancies, many prior pregnancies, young maternal age, advanced maternal age, or pregnancy with 2 fetuses or more. So basically a pregnancy where twins or high order multiples are involved. Now, before I show you the next slide, I want you to think about this slide just for a second. Look at the very first condition. We're talking about high blood pressure. Is massage contraindicated or is it indicated for this condition? It's indicated. Is massage indicated or contraindicated for edema? It's actually indicated. But what they did was hang on a second, I'm trying to advance the slide. So before I showed you the studies, general massage is postponed, but foot massage was actually used in 2 studies. So, and starting at about 20 weeks, we're going to recommend for you to look for generalized or widespread edema. If you've ever had a lymphedema class, you know that this term is anasarca. It's a generalized swelling that you see in many, many conditions. If this is present, you want to postpone massage, but again, you can do foot massage, and foot massage is actually indicated. So here's the first study that I ran across. Foot massage modification to reduce blood pressure in pregnant women with preeclampsia. And these are some of the study details. They did, I love this so much. They did a blood pressure measurement for 6 days without any intervention. Why did they do that? To get a baseline. They want to make sure that the readings that they got before they applied the intervention, i.e. foot flexology, were very consistent. And then they received a 20-minute massage daily for 6 days. And what they noticed was that the blood pressure was significantly reduced when taken 30 minutes after each massage. But the problem with this study was 2 things. Well, one thing. This is called pre-test, post-test. But they had no control group. So later, this study came out. Now, if you look at the top, I mean, the heading of this study, this says the effects of classic foot massage on insomnia. They looked at that, and anxiety in preeclamptic women in a randomized controlled trial. So this is a pretty high level trial, okay? So this one, they did 20 minutes of foot massage before bed, 3 days a week. And it's important to remember too, going back to dispelling myths, they did the inner and outer sides of the foot too, i.e. the ankles, i.e. the uterus and the ovary points, which is another myth that we can't do foot reflexology on these clients either, which is simply not true. But again, they still address the two things in that heading, which is going to be the anxiety and the insomnia, but they also measured blood pressure, and they found that all of it was significantly reduced. And this study is actually more valid, more reliable, because they did have a control group, which means they had a control group that fit all the criteria, but did not receive the intervention. So they were able to compare these results that they received with the treatment group, the group that received the massage, foot massage, versus the control group who did not receive the intervention of foot reflexology. Now, this is my second favorite. So supine hypotensive syndrome. Hopefully everyone has heard of this. This is a drop in blood pressure from compression of a pregnant uterus. And remember, pregnant uterus has got the baby, it's got amniotic fluid, it's got a placenta, it's got lots of stuff in it. So it's going to be pretty heavy. But it's compression against the blood vessels from the pregnant uterus. And what it does is, and again, supine. So important you know that this is when the client's lying on her back. It causes decreased venous return, it reduces cardiac output, and it may decrease placental blood flow, leading to fetal distress. Signs and symptoms, maternal signs and symptoms, are dizziness, lightheadedness, shortness of breath, pallor, which is paleness of skin, nausea, and agitation. So this gives you a graphic of what it looks like. You've got the pregnant uterus, the little sac in her abdomen, and you can see the spine, and they're showing you two major blood vessels, the descending aorta, some people call it descending abdominal aorta, and the inferior vena cava. Now, this is without the tilt. This is the cross section. This came from a nursing manual. And I want you to notice the two blood vessels, the aorta here and the vena cava here, are being compressed against the vertebral bodies in the lumbar vertebra. Okay, this is what's causing the problem. So this is a practice change right here. Okay, so we saw that we can give foot reflexology with a person with preeclampsia. Now I'm going to give you the backstory behind this. 30 degrees is the new degree level. The previous degree level was 15 degrees. Now, what's fascinating about this is that this came from the 70s. The last study that we did on tilt, left lateral tilt, was in the 70s. They had 3 people, and they used blood pressure cuffs to see what the degree is. Now, 2021, 24, there's been a couple of studies to make sure this is accurate. And they didn't have MRI technology back then. They had CAT scans or Doppler technology back then. They used what they had. So what they found is that we want to do the left lateral tilt. I got some pictures to show you of at least 30 degrees or a sideline position, because the argument can be made, my gosh, it's 30 degrees. Why well just put them on their side? And that's a pretty good argument. Beginning about week 22, but look at the sub-bullet earlier if the client is showing, or just if they want to do it. If they want to be in the sideline position, let them do it. What does that mean? That means you want to place a cushion under the right hip while they're in the supine and semi-reclining position, if it's preferred. So here is the study. Effect of lateral tilt angle on the volume of aorta, aorta, inferior vena cava in pregnant and non-pregnant women, determined by magnetic resonance imaging as MRI. And again, they had basically a control group. They had non-pregnant women too, so they can compare the two results. And this is just showing you with the tilt. You can see when you tilt with that wedge or the cushion, you've got the opening up of the blood vessels, the decompression essentially of the blood vessels in the abdomen. Now, this is a 30-degree tilt. As soon as that study came out, the American Heart Association completely revised their guidelines for CPR resuscitation on pregnant clients. So I just love this so much. And who did the study? You got to ask all these questions. Who did the study? Who even wanted to know the answer to these questions? Anesthesiologists. And it makes perfect sense because they're having to do surgery on women. And what can I do? What position does the table need to be in to get the best results for the surgery and to minimize risk to the baby? So they had to get this question answered. So the new practice standard is 30 degrees. Or again, you can just put them in a sideline position. And a couple things about this picture. Notice the foot here is also on a little roll, a towel roll. And notice here that her arm, her bottom arm, if you want to call it, is resting on the pillow. In this picture, this is actually a king size pillow. And this is, and actually this could even be a tiny bit higher, because you want the elbow, the wrist, and the shoulder to be on the same plane, the same transverse or horizontal plane. And you want the top ankle, knee, and hip to be on the same plane. So we can even go a little bit higher. Maybe not this high. Look at the loft of these pillows, but maybe a smaller pillow would not be out of the question. And again, what side, left side, right side, consistently. Every time I look at this question, they're recommending the left side for lots of reasons. The American Pregnancy Association says it helps the blood travel from the heart to the placenta, and it reduces pressure on the liver from, typo from the uterus. Okay, so the question has been asked, can you massage prone? And hopefully by now everyone knows the answer is yes. This is a pregnancy table that you can use. It's got the cutouts for the pregnant belly and also for the breast. And I actually use this kind of table often, just without the belly hole, for two reasons. Number one, a lot of my clients do have implants or surgery. And the second one is without the face rest, and their head is going to be there, it's great to put your hands in to massage the neck and shoulders. So I love it for just doing a great supine neck and shoulder massage. You do have these devices if you want to use them. They are available to you as well. If you didn't want to get a pregnancy table, you can get cushions if you want to. And this is actually from the American College of Obstetrics and Gynecologists, basically reinforcing that idea that you can use tables with cutouts, allowing you to lay face down comfortably. The next question, hopefully myth we're going to bust, and this goes back to your questions about hot stones and hot bamboo too, Carl, is can a pregnant woman use hot tubs or saunas? And I'm going to call this sauna, because this is the way the research study did it, a wet sauna or a dry sauna. We would call it a steam bath, but some groups just call it a wet sauna and a dry sauna, but they're both accurate. So this is the study that I'm going to be talking about, 2019. This is a systematic review, which is considered the absolute best level of evidence that you can get. And I actually looked recently to see if there's been any new updates, and apparently this has withstood the test of 5 or 6 years. There's been nothing updated since then. So what the study tells us is that clients can sit in hot tubs or saunas for 20 minutes or less during any trimester. This is irrespective of trimesters or pregnancy stage. However, the bath temperature limit is 104, or I've added cultural competency. I've added 40 degrees centigrade. The sauna temperature is 158, which is actually kind of cool for a dry sauna. Dry sauna is usually about 170 to 195. So this is a little cooler, of 70 degrees Celsius, or 15% humidity in that sauna. And temperatures or timeframes exceeding these guidelines may result in damage to the unborn. Okay, so we've talked about hydrotherapy. Now we're going to dive into this topic. Can I use essential oils during pregnancy massage? So think about that question. Think how you would answer it if. Now, I hope by now, for goodness sakes, before you answer any question, you must look at the evidence. Okay, don't just regurgitate what you learned in massage school. because practice standards change, practice standards evolve over time. And that's the benefit of classes like this, RC classes, is to help you keep up to date. So now EO means essential oils. So are essential oils safe? The answer is yes. There's no evidence that essential oils applied topically in aromatherapy amounts during pregnancy were abortifacient. This is when we talk to people who know their stuff, this is the term that pops up, abortifacient. Can they cause abortions? There's no evidence that it does or can cause any adverse events. And then the study I'm going to quickly show you. This is from 2021, aromatherapy and in obstetrics, a critical review of the literature. So these two women took a deep dive into this topic. And then they said, well, duh, all essential oils are toxic at high doses. So I thought that was a really nice way to frame this conversation. So I had to add that into this slide. And then going back to that study, they said skin irritation was reported in some cases, but again, that's not abortifacient and that's not considered an adverse event. That's called a side effect. Again, hopefully you guys know the difference between the two. But the authors advised to screen all clients, not just pregnant clients, all clients for skin conditions and allergies before using essential oils. And if you go back and listen to my very first Biotone EduTalk, I did a class on documentation. And in there, I talk about the interview, the vocal, not just the written intake, of how you organize your interview. And PPOM is what we recommend. And A is allergies and skin conditions. So it's something that you should be having a conversation with every client. And this is the study where the information came from. Okay, the next area that we're going to go into is going to be on prenatal depression. Postnatal depression is going to be our conversation of the next talk. And so, so basically the guidelines are follow the standard of care for pregnancy massage when you do it or when you teach it. Now look at that second bullet. It's really important because so many pregnant women don't have a lot of money and don't have access to massage care. But the overall effect should be nurturing and relaxing. Now I'm going to blow your mind with some of these studies. Okay, so just be prepared for some wow. Partner-delivered massage is what's recommended because, again, you're improving access. I'm going to give you a couple of other outcomes. They're going to go, oh my God, I got to get on board with this. So I'm going to show you the study, but I've highlighted that the results of this study was massage given by their significant other. Because remember, sometimes the partner may not be the biological parent. It might be the mom. It might be the best friend. It might be the sibling, one of the siblings of the pregnant woman. So it's just someone who's significant to that person, the pregnant client. Here's another study. Again, massage by their significant other. Here's partner-delivered chair massage, okay? And in these studies, not only was depression reduced, we talk a lot about depression, but anxiety. We don't talk enough about anxiety in pregnancy was also reduced. Again, these are some things that blew my mind. When you teach partners, one partner to massage the pregnant client, the relationships between those partners improve. And you want this, right? We all want this. And the effects extended into the postpartum period. So I cannot tell you enough, if this is a population you want to work with, work on the pregnant client, invite the partner to be in that room with you, or have a separate session where you teach them just some basic massage routines that they can do at home. Very, very evidence-based and very, very compassionate care. Okay, so I'm going to talk about this study. Again, systematic review, I cannot say how important systematic reviews are to our profession. So this one, just look at the effects of and contraindications and side effects during pregnancy. So I give this one a lot of weight when I'm making decisions. Number one, about what to do, and number two, about what to put in my book, and number three, about what to put in the talk. So again, it's an SR, a systematic review. I want to remember that, remind you of that again. So these were the benefits gained by massage for this population. We're looking at all the studies. Reduces stress, decreases back pain and leg pain, lowers depression and anxiety. The others said that too, but this combines a plethora of studies. Increased immune response, elevated levels of serotonin and dopamine, these are two hormones, higher fetal birth rates, reduce the risk of preterm delivery. The only precaution that we need to be concerned about is not miscarriage, it's DVT and PE. DVT is deep vein thrombosis. PE is pulmonary embolism. That is the acute care complication of a dislodged clot, typically there on the left side. In the leg, leg is defined as knee to ankle, knee to ankle. So real quick, what DVT is, it's a thrombus. A thrombus is a medical term for a blood clot. Again, in the term deep vein thrombosis, it's a blood clot within a deep vein. You can see that in the title. Pregnant clients have a 5 or 6 times higher risk for DVT. And important, this risk remains for 10 weeks postpartum. 10 weeks postpartum. So here again, we're seeing how important it is for us to consider those first 3 months after the baby's born as another trimester, right? The signs and symptoms are unilateral, very important here. Unilateral leg swelling, heat, or an increase in temperature, redness or noticeable discoloration, and pain and tenderness, okay? So oftentimes in massage school, we use the acronym SHARP, S-H-A-R-P, to remember the signs and symptoms of DVT. So again, if they have a diagnosis, they come in and they say, I have DVT. It has not been for over 10 years, an absolute contraindication. It's a local contraindication. So if they come in with a diagnosis, you want to avoid the affected lower extremity. And again, lower extremity is defined as leg and thigh. Technically DVT is only in the leg, but we want to up the ante a little bit and just avoid the entire lower extremity. That's a safe practice guideline. If they don't have a diagnosis, because of that high risk factor, you're going to screen for DVT anyway. And again, we've already talked about what the signs and symptoms are in that previous slide. If they're present, even without a diagnosis, you're not diagnosing them. You're just saying you screen positive for the signs and symptoms. You have to hear the conversation of DVT. So you can still give them a massage. You just avoid the affected lower extremity, just like you would do if they had a diagnosis. And then you refer them to their healthcare provider. Now, why do I keep saying healthcare provider? Because nowadays in our society, it's not necessarily the obstetrician, the doctor, the physician who is seeing them. It's oftentimes a nurse practitioner or a physician's assistant even. And again, this slide also talks about what I just mentioned, which is left side DVT is more common than right sided DVT. This guideline, the diagnosis and the no diagnosis guidelines are true for all trimesters. And again, continues for 10 weeks postpartum. And why? Because I can show you at least 7 case reports where leg massage caused adverse events, i.e. pulmonary embolism in pregnant clients. So this is something that has to be on our radar. It's got to be on our radar. Now, this is a screenshot from that study, and I love the way these two researchers did it. So in the blue boxes are the maternal effects, but in the light blue boxes, we talk about the fetal effects. So you can see how it's so important for us to do what we can to reduce the barriers to get pregnant clients on our table. And if we cannot or are not willing to do it, teach partner delivered massage, because look at all these wonderful benefits, but it also helps the baby too. So I just really, really like this slide. And this will be in the handout that you get after the presentation. A little bit about labor and delivery. So this is actually fascinating. It's important to know that labor pain is regarded as one of the most severe types of acute pain described by patients. And non-pharmacologic methods are important to use during labor and delivery because of the negative side effects of narcotics. But when you look at all the research that's been done in this population during labor and delivery, 2 things come up most often. Number 1, reflexology, more specifically foot reflexology, and 2, sacral massage. Sacral massage was not even on my radar until a couple of years ago. And I'm like blown away by the studies and what they're finding. So of course, this is just looking at foot reflexology first. And it does all kinds of things: reduce pain and anxiety, shortens all 3 stages of labor. I love this next one. It decreased all vital signs. Well, not all of them. Pulse rate stayed up. And I'm thinking, probably a good thing, because you want that blood flow to that baby. It increased birth satisfaction. It increased the chances, improved, I should say, it increased mother-infant interactions, including breastfeeding. So that's something near and dear to my heart. Then sacral massage. Okay, so again, it's massage pressing on, applying manual pressure to the sacrum. So we're talking about the pelvis area, okay? 4 studies, and if you look at the bottom of the slide, you can see the citations. 4 studies did this during active labor, okay? So active labor, when it's done, when sacral massage was done during active labor, it reduced labor pain and anxiety, or the concern that women have during labor. It shortened the duration of fetal descent, which is the 2nd stage of labor. But look at the 3rd one. Oh my God. It reduced the percentage of meconium-stained amniotic fluid. This means when you have it, when meconium is fecal matter coming from the baby, and if they have a bowel movement too soon while they're in utero, it can be very devastating to the child. So you don't want that. In fact, if they have brown amniotic fluid, it's usually a red flag. Something's gone wrong. But it reduced the chance. Doing the massage during labor reduced the chance that it's going to happen. I just love that. And it improves labor satisfaction. This is just some cool stuff, guys. Okay, listen to this. This also blew my mind. One study did sacral massage after a C-section, okay? It prevented urinary retention. This is one of the things you've got to be concerned about after surgery, because it's the most common post-cesarean complication is urinary retention. If you can't go to the bathroom, you're not leaving the hospital. Okay, it's that simple. And then the authors of this study recommended sacral massage instead of a catheter. It's like, wow, that's just fantastic. The last thing I want to talk about before we do Q&A is nursing. So if you're a Facebook friend of mine, you've already seen this study, because I got so pumped about this. But one group of researchers said, I wonder if breast milk is different in women who get a massage. So they literally created a study to answer that question. So how would you answer that question? The answer is yes, it does. So this is the first study to see if massage supports breastfeeding after a C-section. They did 40 minutes of reflexology weekly for 8 weeks, and they began 6 hours post-delivery. It decreased pain and fatigue, and the energy level and sleep quality increased, and breastfeeding efficacy increased. I think I jumped the gun. I think the study is the next one I'm talking about. Let's see how we do. Oh, here it is. Yay. Okay, so this is the effect of postpartum period back massage on, I cannot pronounce these, I'm so sorry, but they looked at these 4 constituents in breast milk. And they did find that the last one, that vistatin, was increased, and that is the one that improves weight gain in babies. So I hope that today created a kind of more of a infusion, an energy around pregnancy massage, around sacral massage, around foot reflexology. I hope that it does improve your ability to provide massage to pregnant clients. And so I want to hear what you think. So do we have any questions?
Thank you. Thank you, Susan. Sorry, I was having technical difficulties. But when you were speaking about edema, there were some questions that came in. And Sam was asking, why is massage contraindicated for widespread edema?
Okay, so there's different kinds of edema. There is a regular edema that you're going to have in your ankles, and that's going to be related to the weight of the pregnancy. But when it's, and again, and it's pretty easy to see. It can be pitting edema usually, it can be non-pitting edema, but it's clearly in the lower extremities. But if it's widespread edema, something else is going on in the body. And it's usually not good. So it is they're puffy in the face, their hands are puffy. It is widespread edema. And so that is the kind of edema that is a red flag for the medical community. It's not only massage therapists in the medical community. So there's different kinds of edema. There's also something called angioedema, which is swelling from an allergic reaction. And there's something called ascites, and that's just abdominal edema. And that's usually seen in something like cirrhosis of the liver, those kind of conditions. But so there, when you go into the topic of edema, it could be another future talk. There is different kinds of edema, and they're associated with different conditions. So widespread anasarca is preeclampsia, just general, I think they call it dependent edema. Peripheral edema, that's just going to be, that's associated with usually the third trimester of pregnancy.
Okay, I miss this. Laura had asked, so you work on clients that are less than 12 weeks pregnant?
Yes, absolutely.
Some of the comments, Jen had said she has no issues. It's client's choice. And Christopher agrees, yes, of course. Cecilia, I work at a med spa attached to an OB/GYN and fertility clinic that does regular IUIs. I can't wait to discuss this with our team of OBs.
Yeah, and show them the research. Don't just show them the study, I mean, the talk, show them the research. That'll get their attention.
Great. And then let's see. As a doula, and this is Courtney, as a doula, it was always important to me to have the partner do it, whatever comfort measure that is.
Absolutely. Completely agree.
Great.
I'm glad to see you guys are on board with it. That's just that
having the partner involved.
Oh yeah, yeah, and just reducing the barriers for pregnant women. I mean, it's good for them.
Exactly. And you can't always get to the therapist, so having your partner understand how to help empowers them as well. What about breastfeeding clients? Does peppermint reduce the production of breast milk in high amounts? Should we stay away from it in large amounts in aromatherapy?
Well, again, I would go back. The study that I quoted was obstetrics, which is pregnancy, and you said nursing, that's post. So before I answer that question, I have to look at the research. I'm just that kind of person. So if you shoot me an email, or I will find out the answer to that question. But also remember that that study that I mentioned said all aromatherapy is toxic in high levels. So I would say be careful of high levels, but I'll check into that. Thank you for that question.
And I have a question. So something like peppermint oil, you're not applying it directly to the person's body. Would you put it on a cotton ball or something like that and have them?
Well, there's different application methods. I typically talk about topical application, but you're right, it's with a carrier. There's only a few oils that you can put on without a carrier. It's called NEAT, N-E-A-T. But inhalation is a whole different thing. So you'd have to almost look at each individually to be able to get a good feel for it. But peppermint oil, again, until I look at the research, during pregnancy, it's safe. But the question was nursing.
Breastfeeding, yes.
Breastfeeding, I'm sorry. But yeah, so I'll have to check on that. Thank you.
Okay. And then Courtney adds, it's always used caution. I've always used caution when using peppermint and other mints and with postpartum clients. Some of the mint and eucalyptus oils can cause respiratory distress in some babies.
Okay, that's good to know. Okay.
And then yes, peppermint when nursing is often discouraged. And let me just see. I'm not sure if there has been an actual study done on it.
Okay, I will find out, because someone has got to answer that question with research. It's too important of a question. So I will dig into that and to get back with me on that one. I'll have it for you by April 22nd.
Okay. And Madison actually put a link that she found online. It's in chats. I will put it in the follow-up email tomorrow. And for those of you who are new to the EduTalk series, when you RSVP, the next day you will receive an email follow-up. And the email includes a link to the recording, a copy of the presenter handout, the presenter's contact information so that you can reach out and speak to them directly, And tomorrow's, I will include this link that Madison found online regarding peppermint and I guess aromatherapy, as well as links to Susan's previous EduTalks that are also found on biotone.com under the EduTalk tab in the archive library. Okay, now, Nicole is asking, I have encountered different schools of thought about sideline. Some say left side only, and others say half time on left, half time on right. What do you recommend?
Everything points to left side. I mean, if you're going to do right side, do very briefly, like 5 minutes. But I think the majority of the time needs to be left side because that's what keeps popping up. So, you can't argue with research. I mean, I guess you can, but I wouldn't.
Okay, and Sam is asking, can you explain how sacral massage helps with urinary retention?
Okay, so that's like the $1,000,000 question. So anytime you're talking about a research study, there's two types. You've got what's called basic research and you have clinical research. The clinical research is pretty much what I'm interested in, and that's going to be what does it do? It reduces urinary retention. The basic research is what is it? How does it do it? We don't know, and that's the beauty about it is we don't really know why or how, but we just know it does. So, and these studies are easy, not easy, but are more prevalent. The mechanisms of action studies are actually more rarer. They're less frequent. And oftentimes the researchers will tell you, we don't know, we can theorize, but until we do a study to measure that thing, that mechanism, which is usually done in a laboratory, as opposed to a clinic. That's another thing to think about, the two different kinds of research. You're drawing blood, you're like the MRI, that was considered in a laboratory. We had the MRI machines and that kind of stuff. But the other ones are done in labor and delivery rooms. That's the clinical research.
Okay, and Courtney is saying, thank you for passing along the info. Parents and babies have a sweet spot for her. For over a decade. And Angela, so very informative. Thank you so much, Susan. And Bethany, why do you massage before 12 weeks? How is that not dangerous?
How is it dangerous? I mean, there's no evidence to suggest that it's dangerous. So I just, I hear the argument, but it's always, when I say shallow, I've never seen any evidence that is true. So I'm because it improves pregnancy rates, it improves birth rates. There's no reason not to do it. And again, you're violating civil rights to deny services. If there's a reason to deny services, I am all about it. But if there's no true evidence to deny services, then I'm going to do it. We have one. Okay, so to be fair, we have one woman in the clinic that I work with who, I don't care what the research says, she's not doing it. And you just have to respect their wishes not to and send them to me. So the manager likes it because they're not denying services. Susan will do it. You know what I mean? But if this is something you just really feel uncomfortable with, as long as you've got a place to send them. But I can't. I mean, I was pregnant. I've got, 5 children. And if I am depressed or anxious or tired or just want to relax, and I call you on the phone and I want a massage, please work on me. Please don't deny me. I guess that's the golden rule versus the platinum rule. I'm all about the platinum rule. Would you like to know what the platinum rule is? Mm-hmm. Treat people the way they want to be treated. The golden rule is treat people how you want to be treated. But I embrace the platinum. As long as what the research says is the main thing we have to be worried about is DVT. And it's a simple screen.
Courtney is replying, simply applying touch to a pregnant individual should not cause any fetal harm or maternal harm. And Carrie was asking which edition, but I'm not sure what part of the talk we were for. I was 7, 8?
8. Yeah, this could be the 8th edition, all this information.
All right. And Courtney, again, I think the old information that was out in the past where we were told to use such caution was mostly to cover their ASS
I got you. I got you. We
and
don't need
avoid
to go there.
liability and
But
blame
but you know
in
what?
case
I think about
bad
that. And
outcome.
if that's true, why see patients at all? Why see clients at all? You have more of a chance of someone slipping on your rug. You know what I mean? If that's really your attitude, is to cover your whatever, then you wouldn't service clients because they have less of a chance of getting miscarriage than slipping on your wet floor from water you give them. It's just, in my opinion, in my professional opinion, it's just silly.
Okay, let's see. I have encountered different schools of thought about the sideline. Okay, so we answered that. Nice looking at research here reminds me of my time working at Touch Research Institute at the University of Miami. And this
Love
is
her.
Nicole, participated in pregnancy massage studies.
Yeah, Tiffany Field is such a gem for us. I love the Touch Research Institute.
Oh, fabulous. Back to the DVT. Are the legs supposed to be elevated if you're avoiding that area
It
during a
can be.
massage? Would you recommend elevating the legs?
Absolutely, because again, it's going to be, it's called dependent drainage. If they have edema, it's going to reduce it. And they did this one study, okay, because I'm working on the book that looked at what is the correct level of elevation. That's a legitimate question. And what they found out is 30 degrees, again, back to that 30, go figure, 30 degrees is best. I'm sorry, 60 degrees was the best, but it said it also caused patient discomfort. So again, and that's another thing when you're looking at evidence-based practice, there's three things you have to be concerned with. Number one is the research. What does the evidence say? Two is going to be the patient preferences. So you're not going to do something for a patient like 30 degrees of elevation in your feet if it's causing the patient harm. So without that patient experience, it's not evidence-based practice. And the third one is expertise, is your own expertise. So that's a great study. So elevating is important during the massage. But again, if you're not going to be doing supine, you're going to have to do sideline or get that 30-degree tilt.
All right, we have some thank yous coming in from Anna, very informative.
Thank you, Anna.
Thank you from Carrie. Thank you for freely sharing your knowledge with the massage community. We appreciate your hard work to find truth. And there's a number one, but I'm not sure if that was supposed to be a number one.
Yeah, well, she's one of my dear friends.
Oh, wonderful. Thank you for your time. Thank you all for your time. And again, I'd like to mention that we've turned this into part one of a two-part series that Susan will present on pregnancy. Then April 22nd, and I'm not sure if this is the exact title, it will be C-section and postpartum depression.
And peppermint oil during breastfeeding.
Yeah, all right, we'll get that in too. Again, visit the EduTalk Archive Library on biotone.com. We have been doing EduTalks since COVID, since 2020. So there are wonderful presenters and topics there. Again, tomorrow afternoon, look in your inbox for the follow-up email. If you don't receive it, please email me and I will send it out to you. Also, check your junk mail if you don't see it in your inbox. Please join us for upcoming EduTalks in March. And for those of you that are not familiar with the EduTalk Diabetes series, next week, we will have Linda Lockett-Brown on March 11th presenting Using Fiber to Decrease Blood Sugar Levels. And you can also access the EduTalk Diabetes Library on biotone.com under the EduTalk tab. And that was launched in May 2023. So there's some fabulous topics there that diabetes or not are well worth listening to for a healthy lifestyle. And on March 18th, we have Peggy Lamb presenting 5 pathways to become an abundant body worker. And that will finish March. So watch your inbox for upcoming invitations. Join us for the diabetes series and Peggy Lamb's March 18th EduTalk. And watch your inbox. And Susan, I can't thank you enough. Your talks are always fabulous and informative. And I'm so glad we're going to have a part 2 to this because there's so much more to cover.
There is. Thank you so much. Thank you, EduTalk. Thank you, Biotone. Thank you guys for being here. And I'm just very happy. Thank you.
And you're the bomb,
I'm the bomb.
as Carl says. So, and thank you all from Madison. Thank you everyone for the work you do and joining us for EduTalks. Be safe and take care, and we'll see you next time. Thank you, Susan.
Thank you.
Take care, everyone. Bye-bye.